The medical technologist performs professionals' laboratory work following established clinic procedures and performs chemical and biological tests on patients' specimens for medical diagnosis. A medical technologist or a laboratory technologist analyzes various biological samples to treat or diagnose different diseases. Their main duties include getting biological samples ready to test, conducting blood tests, and creating reports for their findings. What is considered a biological specimen? A human biological specimen is any material derived from a human such as blood, urine, tissues, organs, saliva, DNA, RNA, hair, nail clippings, or any other cells or fluids, whether This is the examples. Blood test procedures in laboratory. During venipuncture, a lab professional known as a phlebotomist will take a blood sample from a vein in your arm using a small needle. Other ways to do a blood test are a finger prick test. What is the finger prick test for? Well, finger prick tests have recently been used for at-home health monitoring. They've been around for a while and have a number of established medical uses, including testing blood from babies and children as well as patients with severe burns, by people with diabetes to measure their blood glucose level. Massage the finger with a downward motion several times before performing the finger stick. Lower the hand below the heart level when collecting blood. Puncture the side of the middle or ring finger for easier sampling. We recommend a 21-gauge single-use safety lancet. Hold the safety lancet and carefully rotate and pull off the protective cup. Press the lancet against the puncture side tight to lance the skin. Gently squeeze and massage the finger in a 1-second interval until a full drop forms. The heel stick. The heel stick procedures involves breaking a newborn's heel, drawing a small amount of blood and placing the blood on filter paper to dry so that it can be analyzed for several diseases including hypothyroidism and sickle cell disease. First, clean the heel with alcohol pad or alcohol wet cotton balls and let the skin air dry. With the heel lancet, stick the heel at a side angle. Wipe away the first blood drop with a sterile gauge with a sterilized gauge pad. Allow a scan large blood drop to form. Fill each circle one at a time until all 5 circles are completely filled. Arterial blood test. An arterial blood gas, ABG, test is a blood test that requires a sample from an artery in your body to measure the levels of oxygen and carbon dioxide in your blood. The test also checks the balance of acids and bases, known as the pH balance in your blood. Use an apron, then wash your hands. Use a gloves. Expel the heparin through the needle. Insert needle at 45 degrees. And observe flashback. Allow syringe to self-fill. Remove needle and apply. Engage needle. Remove and dispose of sharp immediately. Attach cap to ABG syringe and label a sample. Then lastly, say thank you to the patient and sterilize your hands. What do you think is the role of a medical technologist in achieving the goal of health system? We help patients. Medical technologies enable the early and accurate diagnosis of health problems, facilitating timely intervention and improving outcomes. Innovative products can replace, repair, and sustain failing body functions, while telemedicine and connected devices allow remote monitoring and patients' conditions.